It certainly is one of the most emotive questions that I'm often asked in interviews. And it's probably one of the most emotive questions that you could be asked if you're in the boozer, for example, having a pint. Should obese patients pay for their NHS treatment? Right, okay, why am I raising this story on my YouTube channel? I'm raising my story today on this simply because news is out that we now have a waiting list for the NHS of 7 million people. That's a lot of people. I'm sure you'd agree with that. And quite rightly, the taxpayer, a big significant proportion of the taxpayers, I would imagine, would ask the question, is it time that actually, if you are too fat, and there is something you can do about it, why should you be prioritized for surgery and so forth? And the question then comes is obesity or is being fat a choice? And I'm going to answer those questions directly, and please feel free to subscribe to this channel if you like it. Make sure you like the video and do comment below with your own point of view, keeping it troll light free if you possibly can. Okay, so first of all, I'm going to answer the question, is obesity a choice? The answer to that is a direct yes. Obesity is a choice. However, there will be a proportion of people, albeit in my opinion, a small proportion of people, that actually find it more difficult to manage their weight because of certain other conditions, restrictions, mental health issues, etc. Do I believe that that proportion is large? No, I don't. Do I believe most people become obese because they've got mental lethargy, mindset lethargy? Yes, I do. Okay. I've always said it and always will, that to lose weight, to manage weight is all about motivation. And if an individual does not have the motivation, they'll find it very difficult to lose weight and live the slim life, the healthier life. The next question, of course, comes, should people that have not taken care of their own weight actually be charged extra for certain NHS procedures, such as hip operations or operations on the legs, for example? Should they contribute to type 2 diabetes medication? That's been asked before. My answer to that is, if someone has not got an obvious, evident underlying reason for it being difficult to manage their weight, my answer is yes, they should. They should pay a charge. Now, most people may scream out and say, yes, but what about people that drink a lot? What about people that smoke? Okay, I'm talking about obesity here, and maybe the same sort of decision or should be applied to those people as well. I'm talking about obesity here. So on a very practical level, what would that mean? That would mean, in my mind, logically, that if someone has, in the eyes of a GP, for example, has not got a significant underlying reason for that patient being obese and remaining obese, if there is no underlying reason, should they pay for their treatment? Yes, they should. And here's another reason why, is the taxpayer pays for that service. That is important to remember. Yeah. The other reason, which is a bit of tough love, I guess, some may call it, is that if you are paying, if you know you've got to pay for your treatment, then it may act for some people as a motivator to actually get well, eat better, move more, all the things we know we should do, so that they actually live a longer life as well. So in some ways, it's a measure of being cruel to be kind. It's an emotive question. It always will be. But that's my own opinion. I'd like to know what you think. I'd like to know what you think out there. So if you feel you can comment on this, then do. Yeah, all opinions. You may disagree with me. You may agree with me. Either way is absolutely fine. That's what discussion and opinion and debate is all about. The world would be so dull if we were all saying the same thing. So there you go. That's my opinion on it. And let's remember, just again, in the UK, we have around 7 million people waiting for an operation. or a procedure with the NHS. The taxpayer is paying it. You know, the NHS is sinking. So my question is as well, is it that links to this, is it time to take responsibility? And is it time to get just a bit tougher? I think it is. On that note, bye for now. Let's hear your comment.